Selenium is a remedy which is indicated for both extremes of life, that is, for young children and old people, or young children who look prematurely old. It is predominantly a male remedy. The remedies which are similar in some aspects are Lycopodium, Syphilis, and Baryta. Lycopodium is very intelligent, and the physical characteristics are craving for sweets, lines on forehead, and flatulence passing from rectum. Syphilis is a remedy which produces premature senility at the physical and mental level. There are characteristics which express very clearly the symptoms of syphilis, like a patch of grey hair, or baldness right from young age, or depressed nose bridge. It will also show some symptoms of destruction. The old look is very obvious. There is a marked debility even at the beginning of day. Night aggravation and violence is very clearly expressed. Syphilis gets aggravated by kind words.
In Baryta, there is patchy development at the level of milestones. One of the milestone is delayed. It could be either walking, talking, or thieving. The child responds slowly and reacts slowly to external stimuli and forgets things easily. Memory is very poor.
The causative factors in selenium are very important. The causative factors produce a very deep impression on the system. It changes the constitution at a very deep level and forces it to produce symptoms which express predominantly at the syphilitic level. The most important causative factors are prolonged sickness, prolonged fever, alcoholism, sexual excesses, loss of fluid, masturbation, debauchery, lemonade and tea. The patient suffers from generalized weakness and debility. He has no desire to work or to do anything whatsoever, right from arising in the morning. Even in children, there is so much weakness they do not want to get up from the bed. He feels bored even at the beginning of the day. There is no enthusiasm and liveliness. He looks much older than his age.
It is an excellent remedy for premature senility.
It is difficult to manage these children, as they do not have the energy to do anything. There is a marked forgetfulness, especially in studies. He forgets what he has just learned. If you teach him some lesson like mathematics, the next week you have to start from zero again because he has forgotten all that he has learned. This child is not very creative. They have many thoughts, confusing thoughts, but not much of creativity. These children have grey hair at a very early age. They are weak in their studies. They fail to understand what they hear or read. They have progressive degeneration. This child stammers a lot because of excitement. As they grow, debility continues. They are not able to concentrate on their job. They have an aversion to do any mental work or business. There is a marked weakness and debility even at the sexual level. The penis is totally relaxed, and there is confusion after coition.
Debility progresses and marked exhaustion is followed by extreme sadness.
In selenium, depression begins at the physical level and progresses to the mental level. Compare gratiola. In gratiola, there is mental exhaustion which gradually progresses to the physical level, and there is weakness with the desire to rest or sleep. Selenium depression sets in very early in life and progresses gradually, just like senility. He develops a marked aversion to his closest friends. Compare Magmure. The patient feels exhausted and depressed after a long continued thrill.
Patient has many thoughts. Action is at mental level.
On the sexual front, the desire is increased, +3, but ability to perform is low. These symptoms bring in more depression, and he gets suicidal thoughts. He wants to hang himself because he cannot perform at all. This can be a very important point in Selenium. As soon as he makes an attempt for coition, the penis relaxes. In Selenium, the sleep is disturbed until midnight. Patient awakens always at the same hour and there is palpitation during sleep. There is marked weakness, debility and dribbling of urine. Semen passes while passing stool or straining at stool. Semen after stool and urine. Semen is very thin and odorless. Pulsation in the whole body, especially in the abdomen after eating. Emaciation of single parts, that is, face, hands, thighs, etc.
Degeneration. There is marked degeneration of liver, alopecia, partial on head, eyebrows and genitals. Hearing is impaired. Teeth cavities.
Graying and hair fall at a very young age. Nerves which get affected are genitourinary, supraorbital and larynx. Perspiration is offensive, salty and stains the clothes.
Stool is like filaments of hair. Skin has dry eruptions with itching in folds.
Paralytic pains in the small of the back, which get aggravated in the morning. Marked desire for brandy, alcohol and strong drinks. In Selenium, the headache is above the left eye. Increases with tea or walking in the sun and by strong odors. Acidity is aggravated by tea, thuja. There is an irresistible desire to sleep even while listening to a lecture. While listening to a program, the person goes to sleep. Prostatitis with sexual atony. Aggravations increased by heat +3. Tobacco, sleep by a draught of air, by coition. Coition gives rise to irritability, by a loss of sleep. Night watching, by mental exertion, by the inhalation of cold air.
Ameliorations. After sunset, cold air and drinking cold water.